Member for Richmond North Centre.
Thank you, Honourable Speaker. 192 families continue to ask questions about the implementation of government policy to delay the declaration of outbreaks in long-term care homes. At Little Mountain Care Home, 41 seniors lost their lives. On November 20th, 2020, the first COVID case was detected. Yet, for days, an outbreak was not declared because of a change in government policy. Bernadette Zheng's grandmother died at Little Mountain. She says, and I quote, "People were asking, how did this happen? And then all we got was the reiteration of protocols in place. If families had not talked to the media, this would have been swept under the rug." End quote. My question is to the Premier. Will the Premier tell families why this disastrous policy was implemented at long-term care home? Will the Premier explain what the government knew, when they knew it, and why this government's policy change was kept from the public?
Minister of Health.
Thank you to the member for her question. In British Columbia, we have made every effort, extraordinary efforts, to protect people in long-term care in a pandemic, both to support their other health needs, which include social needs, but also to keep people protected. And that's happened from the beginning, the single site order that was brought into place. Here in British Columbia, virtually nowhere else in the country has that been done with the effectiveness, because we gave it the resources it needed. The extraordinary work of the provincial health officer and medical health officers to support people in long-term care. And still, many people have lost their lives in long-term care. And we, in every single case, not in some cases, but in every single case, review and work to try and improve the situation in long-term care. And you've seen that reflected in action. The member is asking about the declaration of outbreaks. And she knows that that is statutorily the responsibility of the provincial health officer and medical health officers. And I'm not stepping away from backing them up on that. I support them 100% on these questions, but it's statutorily their authority. And those medical health officers have been with those families and with those residents. People in public health care went into outbreaks to support people because of those efforts. They, in effect, did something that all of us wouldn't want to do, which is move towards the flame and the difficulties. And I think that their efforts and their professional experience and their analysis deserve our respect. It's one thing to say that we support public health. It's another thing to support public health. I do that, recognizing the extraordinary pain that everybody who's lost anyone in this pandemic, but particularly in long-term care, feels today. I thank the member for her question, and we're going to continue to do everything we can to support our residents in long-term care in the coming months.